Good afternoon, welcome to the clinic. So today I want to explore some words from the medical dictionary here, bring you those definitions of said words, and we'll travel from A to Z. So your first word which I'm going to locate is autocrine, which is an adjective describing the production by a cell of substances such as hormones or growth factors that can influence the growth of the cell that produces them. Okay, and for B, we've landed on bronchus. Plural is bronchi. Any of the air passages behind the trachea that has cartilage and mucous glands in its walls. The trachea divides into two main bronchi, which divide successively into 5 lobar bronchi, 20 segmental bronchi, and 2 or 3 more divisions. Okay, straight away we've landed on a good C word here. We have cranial nerves, the 12 pairs of nerves that arise directly from the brain and leave the skull through separate apertures. They are conventionally given Roman numerals. Okay, your next word begins with D. We have demyelination, damage to the myelin sheaths surrounding the nerve fibres in the central or peripheral nervous system. This in turn affects the function of the nerve fibres which the myelin normally supports. Demyelination may be a primary disorder, as in multiple sclerosis. There may be associated nerve fibre damage. For E, we have endotoxin, a poison generally harmful to all body tissues, contained within certain gram-negative bacteria and released only when the bacterial cell is broken down or dies or disintegrates. Okay, now I'm looking for F. We have fluorescent, the emission of light by a material as it absorbs radiation from outside. The radiation absorbed may be visible or invisible. Example, ultraviolet rays or X-rays. Okay, we've stumbled upon glaucoma here, a condition in which loss of vision occurs because of an abnormally high pressure in the eye. In most cases, there is no other ocular disease. This is known as primary glaucoma, and there are 2 pathologically distinct types: acute and chronic. And for H, we have hiccup, abrupt involuntary lowering of the diaphragm and closure of the sound-producing folds at the upper end of the trachea, producing a characteristic sound as the breath is drawn in. Hiccups, which usually occur repeatedly, may be caused by indigestion or more serious disorders such as alcoholism. Let's have a look for an I word for you. We have intrinsic muscle, a muscle that is contained entirely within an organ or part it acts on. For example, there are intrinsic muscles of the tongue whose contractions change the shape of the tongue. Okay, for J, not spelled for choice with J words. Let's have a look. We have jaw. Either the maxilla or the mandible. The jaws form the framework of the mouth and provide attachment for the teeth. And now we're on to K. Another ocular one here. We have keratitis, inflammation of the cornea of the eye waters and is very painful and vision is blurred. It may be due to physical or chemical agents or result from infection. Okay, and L. Let's find a good one for you. We have loop, which is a small magnifying hand lens used for examining the front part of the eye, usually with a pocket torch, or provide illumination. In modern practice, a slit lamp microscope is used. And we have M next. We have myotic, a drug that causes the pupil of the eye to contract. Myotics, such as pilocarpine, are used to counteract the dilation of the pupil caused by drugs such as phenylephrine and to reduce the pressure in the eye in the treatment of glaucoma. Okay, another ocular word I've found here, or something that can affect the eye. We have nevus, a birthmark, a clearly defined malformation of the skin present at birth. There are many different types of nevi. Some include the strawberry nevus and port wine stain, are composed of small blood vessels. The strawberry nevus is a raised red lump usually appearing on the face and growing rapidly in the first month of life. These birthmarks slowly resolve and spontaneously disappear between the ages of 5 and 10. And just going down here, we have a nevus of aorta. This is a blue-grey pigmented area on the cheek, eyelid or forehead, with similar pigmentation of the sclera of the eye. It is associated with melanomas of the uvea, orbit and brain, as well as with glaucoma of the affected eye. And for O, we're doing quite well with these ocular words. We have ophthalmologist, which is a doctor who specialises in the diagnosis and treatment of eye diseases. We're sport for choice with P words. We have progeria, a very rare condition in which all the signs of old age appear and progress in a child, so that senility is reached before puberty. Okay, and for Q, we have quadrantenopia, absence or loss of 1/4 of the visual field, i.e. upper nasal, upper temporal, lower nasal or lower temporal. Another ocular word, we have retinal detachment or detached retina, separation of the inner nervous layer of the retina from the outer pigmented layer, known as the retinal pigmented epithelium, to which it is attached. It commonly occurs when one or more holes in the retina allow fluid from the vitreous cavity of the eyeball to accumulate under the retina. Vision is lost in the affected part of the retina. The condition can be treated surgically by creating patches of scar tissue between the retina and the choroid by application of extreme cold. Okay, now we're looking for a nice S word. We have, in fact, let's move on from that one. This one needs to be a good S word. We have sleep apnea, cessation of breathing during sleep, which may be obstructive due to frustrated efforts to breathe against blocked upper airways, or central, in which there is no evidence of any voluntary effort. Okay, and for T, We have tendinitis, inflammation of a tendon. It occurs most commonly after excessive overuse, but is sometimes due to bacterial infection, example gonorrhea, or a generalized rheumatic disease, example rheumatoid arthritis, or ankylosing spondylitis. Treatment is by rest, achieved sometimes by splinting the adjacent joint, and corticosteroid injection into the tender area around the tendon. Tendinitis at the insertion of the supraspinatus muscle is a frequent cause of pain and restricted movement in the shoulder. And for you, we have urea, the main breakdown product of protein metabolism. It is the chemical form in which unrequired nitrogen is excreted from the body in the urine. Urea is formed in the liver from ammonia and carbon dioxide in a series of enzyme-mediated reactions. Accumulation of urea in the bloodstream, together with other nitrogenous compounds, is due to kidney failure and gives rise to uremia. Okay, coming towards the end now. We're looking for V. We have vertigo, disabling sensation in which the affected individual feels that either he, himself, or his surroundings are in a state of constant movement. It is most often a spinning sensation, but there may be a feeling that the ground is tilting. It is a symptom of disease either in the labyrinth of the inner ear or in the vestibular nerve or its nuclei in the brainstem, which are involved in the sensation of balance. And now we're on to V. We have visual acuity, sharpness of vision, the degree to which a person is able to distinguish and resolve fine detail. Visual acuity depends on how well objects are illuminated and upon such factors as practice and motivation, but the essential requirements are a healthy retina and the ability of the eye to focus incoming light to form a sharp image on the retina. And W, we have warfarin, an anticoagulant used mainly in the treatment of coronary or venous thrombosis to reduce the risk of embolism. It is given by mouth. The principal toxic effect is local bleeding, usually from the gums or other mucous membranes. Warfarin has also been used as a rat poison. Well, that was news to me. Let's see what we've got for X. We have X chromosome, the sex chromosome present in both sexes. Women have 2 X chromosomes and men 1. Genes for some important genetic disorders, including haemophilia, are carried on the X chromosome. These genes are described as sex-linked. We have one page of Y words only. We have yawning, a reflex action in which the mouth is open wide and air is drawn into the lungs, then slowly released. It is a result of drowsiness, fatigue, or boredom. Okay, for Z, we have zonule, a small band or zone. For example, the zonule of Zinn is the suspensory ligament of the eye, holding or maintaining the position of the crystalline lens. So that's all your words. I hope you enjoyed that little tour of my old medical dictionary. I'm going to let you go now.